All right. Thanks so much for being on the Friends with Wheels podcast. I appreciate it. My first question that I have for you is, just tell the audience a little bit about yourself, how you started, and we can go from there.
So, my name is Kiley Blake. I am an athletic trainer in Arizona. Um, you want an educational background?
Yeah, sure. Just kind of a general background of how you got started. Yeah.
Okay, so I originally started in Utah with going to the University of Utah, the athletic training program. And then after I earned that, I went to the Utah Valley University and I got a degree in psychology. I started in on that actually because of my sister. She's a physical therapist and she went to school with an athletic trainer during her program. And so she recommended that. So I actually went down that path following her advice. And after practicing for a few years, I moved back to Arizona, which is my hometown, northern Arizona. And I actually met my husband while I was working a wrestling event in Prescott. And I realized how much smarter he was than me. So I went and I got my master's degree in athletic training at AT Still University. And then I followed with my doctorate about a year later. I've worked kind of every setting of athletic training from rodeo to performing arts, from semi-pro teams to my favorite, which has been a high school setting. And I recently opened up my own practice in my hometown. And I've been trying to kind of bridge the gap for active individuals in my area and provide them a more specific type of care, sports medicine specific. And I've been loving it. It's been great. Everything's worked out perfectly.
So tell me a little bit about what you do on the sport on as an athletic trainer, but also on the sports medicine side.
So as an athletic trainer, we provide care in a lot of ways. Um, Most of my professional background has been, like I said, in the secondary setting. So when you're employed at a high school as an athletic trainer, you're kind of at times a glorified water girl. So you make sure that the athletes are hydrated all the time, that each of the teams has what they need. But then you're also working preventative care, injury rehab, identifying injuries, evaluating them, also supporting their mental health, making sure that when they're injured, that they don't go down a darker path. Because a lot of our young athletes, they identify as an athlete. So if they're injured and out of practice, then that's not good. So I try to provide whole patient healthcare to all of my patients, no matter what age they are. So I provide care also during events, games, competitions. So if there's a wrestling match, I'm there near the mat, making sure that everyone's safe. If something happens, then I provide emergency medical care until an ambulance would arrive, EMTs or paramedics. And in my office setting, I work more preventative injury evaluation, injury rehabilitation, treatment. Just if there's something that's limiting somebody, we try to fix that and then put them back into whatever activity they love the most, whether that's pickleball or CrossFit, or if they're mountain bikers. Really, just kind of taking care of anyone who moves around and does whatever type of activity. When I was in Utah, I also worked the Paralympics that was up there, I think probably 8 or 10 years ago now. So there was an archery event that I covered also, just making sure that the athletes were okay. There's a lot of shoulder kind of issues, obviously, with archery. So we're really kind of like a Swiss Army knife. We do a little bit of everything and all of it. It's a fun career to be in.
hmm let me touch on something that you said about sort of the rehabilitation process and how you help athletes not just recover like both physically, but also you said something about the mental health aspect as well, because the body and mind are interconnected. They go together. So I'm wondering what's your process and how you go about that.
So in the high school setting, there's a PHQ-4, which is a mental health screening that athletes have to complete yearly as part of their pre-participation physical exam. So that kind of gives us a baseline of how they're feeling and how they're, I guess, dealing with everything. But it is a self-reported assessment. So obviously, if somebody says that they're feeling fantastic when they're actually not, we can't really do too much about that. But most of it is just knowing your patients and your athletes and being connected with their coaches and their parents, making sure that everyone kind of has their eye on the athletes as much as we can, and just being able to provide services and resources and refer out to the um, proper individual to help better take care of an athlete if we suspect some sort of struggle that the athlete is dealing with. So really, it's kind of just being a point person and being able to just connect them with the right person.
Mm-hmm. And what have you learned in doing this kind of work in as an athletic trainer?
Patience. I've learned a lot of patience. Working with high school kids is a very rewarding job, but it's got its ups and downs. You know, you're helping grow young athletes, young people into young adults, and eventually you watch them grow up and become an adult and have their own family. So you're definitely part of a lot of things. And then even with my more aged, my wiser patients, they still teach you a thing or two. You learn a lot from the people that you surround yourself with and when you provide care for them. I've learned every time I step near somebody who's hurt that I want to take care of them, which has kept me educating myself further, which has kept me going back to school to learn more so that I can be the best that I can to provide for them. But really, it's fun. It's not taking life too seriously and just enjoying it as it comes and doing what you can to make it better when you can.
Mm-hmm. And what do you hope to do in terms of something new? Do you plan to like stay at the high school level, or like go to more at the collegiate level, like at colleges, or what's sort of your plan?
So I've worked secondary setting for about 10 years now. I helped out with the D1 sports at the University of Utah during my undergraduate and for a little bit after. I've resigned from my position at the high school that I've been at for 4 years, it was not the easiest thing to do. But I'm going to focus more on my business now, just kind of growing it and shaping it into something that's long and sustainable. Um, I think I found my area because like I said, I've worked everything. I'll still occasionally help out with a local rodeo and professional bull riding and see whoever needs seeing, but potentially also work into education using my experiences to educate the new upcoming athletic trainers. I actually have had the pleasure to work with a few athletes and really great student athletes who have gone on to pursue athletic training. So I think it would be fun to watch them grow as professionals. It's been great doing that already, but to be on the other end of it, instead of a student, to be an educator and help them be better than I was so that the patients get more than I was able to provide.
Mm-hmm. And what tips or advice would you give to those who want to go into athletic training? Obviously, having a lot of patience is one, but can what other tips or advice would you have for those who want to do that?
I would say be used to not having a regular schedule. Things change pretty often. Games change, practices change. You think you're going to have an early night, you end up having a later night than usual. You just need to be very flexible. You need to be able to perform in chaos because sometimes your athletic training room is going to be full of 20 plus athletes. Um, you kind of need to be able to ebb and flow with the changing of the seasons, the sport, the injury bugs that come and go, and to be able to perform under pressure. If you panic too easily, then you're not going to be able to help someone in an emergency situation. Um,
Mm-hmm.
And be a good
Okay.
conversationalist because there's lots of chit chat to build rapport with your patients. So you got to learn some things, learn a couple jokes
Yeah.
to keep people laughing too.
Yeah, exactly. Yeah. Alrighty.